Hi, this is Dr. Jen Peña, and I'm here to tell you all the things sexual and reproductive health that are dominating your group chat. Welcome to Doom Scroll. Hi, Lizzy. It's so nice to see you.
It's nice to see you too. I want to talk to you about Texas becoming the 24th state to eliminate the tampon tax. What exactly is the tampon tax and what is period poverty?
So what that means is the sales tax, right? That's added to feminine hygiene products. Pretty much everything that we could use for our periods. So pads, menstrual cups, tampons, etc. And, I think the most important thing to remember is that these products are necessary to manage our periods. They're not luxury items. Removing the sales tax on these items is going to increase accessibility for people. And I think it's a wonderful thing. Period poverty refers to, it's that lack of access to these hygiene products for your periods. Most of the time it's due to financial constraints. Sometimes it's due to availability of these products, but most of the time it's just, the financial inability of some people to be able to afford period items.
So, why has it taken so long for states like Texas to view these products as necessities versus luxury goods?
A lot of the issues come with just old historical tax codes, right, that have been in place for a long, long time. And they might not have been updated regularly to reflect how society has been changing and how these discussions about feminine hygiene, feminine sexual reproductive health, menstruation has been changing with the times. Gender bias might also play a role where these menstrual products might not be seen as essential, and they're again kind of designated to be more luxury than essential items.
Thinking about this concept of gender bias, how come things like Viagra and Rogaine are exempt from this tax, but period products are not?
This tampon tax, some state policy tax analysts will tell you, is a misnomer because it's not specific to feminine hygiene products. There are, shampoo taxes or toilet paper taxes just as much as there's tampon taxes. That's important to be clear when it comes to Rogaine and medications. So things that are food and medications do have a lot of tax exemptions in a state by state basis because they are essential products. So I think the important piece of this narrative or this discussion is, what is menstruation considered? Should it be considered a disease, an illness, or, something that's medically an issue versus just a grooming product? So once we get legislature to understand that menstruation is a normal part of sexual and reproductive female health, and these products should be considered essential just like food and medicine, then we can start having the discussion about removing those unfair taxes.
I want to talk to you about makeshift period products and why they're so dangerous.
We're talking about period poverty and that lack of access to menstrual products, whether it be because of financial constraints or inability to access them because they're not available. It leads a lot of women, unfortunately, to get creative. They can be ineffective. I mean, sometimes these products, when you makeshift them, they're not made to absorb a lot of blood. And so, that could be inadequate. From a hygiene perspective, it can increase the risk of infections if you're using something like an old rag that's not necessarily sterile or clean. And that can allow for bacteria, viruses to get into the reproductive tract. I get this question a lot. If you look at tampon boxes, they always have this warning for toxic shock syndrome. And that's a real thing. Essentially, staph and strep bacteria can cause a body infection that can be deadly. And when you're makeshifting products that are not sterile, again, and inserting them into your vaginal canal can predispose you to toxic shock syndrome and death. There's a real big issue, again, with the ability to access products that are sanitary, that are sterile and healthy. If you're making these things up at home with other products, can cost you your life. Women who might have challenges with accessing these products, the good thing is that there's schools, a lot of schools, colleges have started to put free feminine hygiene products in the restrooms or in student health services. A lot of employers have started putting free menstrual products in their restrooms as a way to improve employee well-being. There's a lot of non-for-profit organizations, shelters, community centers, Planned Parenthood, clinics, food banks that are making these accessible for people. So I encourage women to go online, research, go to your community centers and ask for, places where you can find these products if you're having difficulty accessing them.
Thank you so much, Dr. Jen. I'll talk to you soon. Have a great day.